Hello, we've been talking about this credentialed scientific magazine called Consumer Reports. I don't know if you've ever picked up a copy, but I think it's pretty fun. Especially when you're going to purchase some items and want to do a compare and contrasting from a battery of people other than your salesman. But this article on what doctors wish their patients knew still gets my attention. There's one piece in here about pain. I know. Chiropractic is in the wellness business. I know. And I also know that many of your patients come in with complaints of not being well, and sometimes that includes pain. So let's get over the idea here is that pain is really an entry point into a relationship with you, a mentoring, a healthcare concierge, if you must. So the idea here is that, again, just as a reminder, they took 660 primary physicians and over 49,000 Consumer Reports subscribers, and they surveyed them. One of the things that came out here is the idea of effectiveness when it comes to taking care and minimizing pain and minimizing disability. What do the patients think and what do the doctors think? So the patients, the underlying and highlight of this particular section talked in the terms that the doctors were actually harder on themselves when it comes to judging whether or not their care plan and their recommendations and their treatment has been effective in minimizing that pain and disability and all the things that go with lifestyle changes as a result of not having a condition. That the doctors were harder on themselves in judging that effectiveness than the patients were. As a matter of fact, the numbers are pretty amazing. 37% of the physicians thought that they were very effective. That's all. And that 60% of them thought that they were somewhat effective. Now catch this. In contrast, when the patients were surveyed, 79% of the patients felt that their doctor had helped minimize pain and discomfort. Big disparity. What's to account for that? Well, one idea here is that a patient experiences their own condition. They have their point of reference, and maybe a family member or two, but for the most part, their effectiveness and their scale and their rating of that is based on their care, their direct response. Yet when it comes to your effectiveness, you look at your entire career. Not just the day, but you look at the entire career. If you've been in practice for a long time, that's 20 years, 30 years, 15 years, or 5 years. As you get this accumulative database going of all the responses that you've ever had in all of your patients, that's how you see things. And when the doctor sees that this disparity, it's very easy to see why we're kind of down on ourselves. I want you to snap out of it. And check this out. Of course, these were primary care physicians, and that they were responding to things that you take care of every day. The conditions that come to you, while chiropractic isn't conditional, we take care of people because we have a philosophy, science, and art to apply to human suffering. The idea here is that the typical things that most of us see, whether they're a primary physician or a chiropractor, are things like fibromyalgia, things like neck and back pain, things like chronic immune problems, whether that's arthritic conditions or whatever. And the big one here, headaches. So the conditions that are more chronic in nature create less of a patient satisfaction, of course. And of course, the doctor's rating of that is also demonstrated. So when we have these chronic conditions, the patients are more likely to complain about ineffective treatments. I would imagine that our studies are showing that patients with neck and back pain, patients with headaches, are getting some great response, and fibromyalgia are getting better results and better effectiveness and better patient compliance and satisfaction than the typical MD. But But let's not just hang our hat here. Let's just step back and get an appreciation that we take care of sick people and that this is a long distance race. If this is your enduring purpose, your passion, I'm looking out through our windows here at DC Mentors offices and I'm looking at Lake Tahoe and beyond. If our enduring purpose and passion is to eliminate needless suffering, we need to not toughen up, but we need to put things into perspective so that we can say next and take care of the next patient and the next patient. And yes, you chose this life, or it was chosen for you regardless. You got to get better at your skill sets. You have to get your soft skills on. You have to get your ability to take your own temperature and respond to the patients that aren't getting well. Some of them don't. And also hang your hat on the ones that are so that you can go in that next day and go, there's another one that I've helped. The idea here is that the higher marks for patient satisfaction, whether it's in a physician's office or a chiropractor's office, as you can imagine, is the doctor who explains and gives the patient SMART goals: specific, measurable, achievable, realistic, and a timeline. And then helps the patients with chronic conditions know when to return for care. Now, I know we're not symptom-oriented, but we're patient-oriented and we're patient-centered. And the patient's experience on these chronic conditions has a threshold. Then we can teach with each patient what that threshold might be. If they're in this chronic background noise of pain, that if they would come to your office every day for that, you would be pretty ill-advised to get patients to come 5 times a day just because they hurt. These people, you have to have your findings, not just the feelings. And you might want to help them with their feelings by creating a scale of when it gets to this point, come back. I'm not talking about the initial care plans, so back off for a moment. I'm talking about the long-range relationship you have with patients with chronic conditions. I think this is, as we're talking about this, a very highlighted point, please underscore this, that you want to develop a way of being with each individual patient, particularly the chronic ones, of being able to come up with a strategy of, when it gets to this point, give me a call. Or after we've made our adjustment, give me a call if it's not subsided in 48 hours. I'm talking about the patients who trust you, are going to be your long-standing relationships. It's a very, very, very amazing and an important, enriched part of being the leader of the tribe in your community.